Hi, my name is Windsor Shuey, and today I'll be performing the administration of an ophthalmic medication, which is an eye drop medication. So to begin, I would begin by verifying the patient orders, and then I would go ahead and I would verify the right patient, drug, dose, time, route, and then the sixth right is documentation. I would go ahead and check the EHR and verify the order. And then I will verbalize the dose out loud. In this case, the right dose of this medication is 2 drops per eye. So then I would go into the patient room. I would introduce myself. I would close the curtain for patient privacy. Mr. Smith, can you please verify your name and date of birth for me, please? Awesome. Thank you, Mr. Smith. Do you have any allergies that you are aware of? No? Okay. So today we're going to go ahead and administer these eye drops. These are used for after LASIK. They aid in like eye itching. They can moisturize dry eyes, that kind of stuff. Some side effects that you should keep an eye out for are blurred vision, swelling eyelids. Sometimes the eyes can feel a little bit irritated. You might feel some burning or stinging when I administer this. So please go ahead and let me know if you're feeling any side effects. So first, before I begin, I'd go ahead and perform hand hygiene. I would administer clean gloves. All right, Mr. Smith, it looks like you have some crusting on your eye, so I'm gonna go ahead and just gently wipe that off. I would make sure that this is warm and wet, and I would slightly compress, I wouldn't push that hard. I would slightly compress the crusting, and then I would wipe it from the inner to the outer canthus on both sides. Let it sit and soak for a little bit, and then rub. Perfect. Then I would dispose of this. I would dispose of my gloves. I would go ahead and perform hand hygiene a second time, and I would go ahead and don clean gloves. Oh, these are a different size. All right. All right, so now I'm going to go ahead and administer your eye drops. Is that okay, Mr. Smith? Perfect. All right, so first I would go ahead and, it says to use a Kleenex, and I would go ahead and I would pull down to expose the conjunctival sac. I would hold my drops about 1, maybe 2 centimeters up. I would ask the patient to go ahead and look up, and I would drop 2 drops into the sac. And I would go ahead and perform the procedure on the other side. So let's see if I can flip sides here. Go ahead and pull down, again exposing that sac. Administer 1, 2 drops. If the patient blinked or if the patient closed their eyes, I would go ahead and administer the medication again. All right, Mr. Smith. Next, I'm going to apply some gentle pressure on the nasocryminal duct. Maybe for about 30 to 60 seconds, just to go ahead and make sure that it's absorbed. And then once that is done, I will go ahead and remove my gloves, perform hand hygiene, and then I would go ahead and document the procedure. Thank you for watching.